Welcome to the Prevention Collaborative's Conversation podcasts. In these episodes, our staff and partners will cover the most pressing issues relevant to the violence prevention field. Our discussions cover a wide range of topics, including feminism, poor mental health, sustainable funding, and much more. Stay informed and inspired within the prevention of violence against women and children space. Start listening to join the conversation today.
Hi, everyone. Welcome. My name is Jane Kato-Wallace, and I'm a senior associate with the Prevention Collaborative.
And hi, everyone. I'm Kate Doyle, also a senior associate at the Collaborative.
And we're here to talk a little bit about the Prevention Collaborative's efforts to prevent both violence against women and violence against children, or what we call VALVAC for shorthand.
Jane, can you believe it's been more than 10 years that we've been working together, either at the Collaborative or in our previous jobs? I still remember the first time that we met. It was in Rwanda, and we were both there to do a training with partners around how to engage men in challenging, unequal gender norms and preventing violence in the family. And it's still such a key memory for me of this work and the opportunity that working with partners presents to address violence. I remember we were doing training on, how to engage fathers, particularly during the period of pregnancy and try and challenge gender stereotypes.
That's
And
right.
thinking about the ways in which, men in communities can be engaged to do that. And we were doing some amazing role plays where there were fathers who had to, or staff from the organization who were pretending to be fathers, who then had to role play what it would be like to be in the delivery room or supporting their pregnant partner during labor. And I can still remember actually like tears rolling down my face
Yeah.
in watching some of the role plays. I remember someone grabbing those Apple earphones and putting them on and wearing them and pretending it was a stethoscope and like pretending to listen. And the role plays were so funny. And it was just such a great opportunity to see that like this work can actually be really simple to work in communities and to challenge gender norms. It can also be
Mhm.
fun. And I think from that moment I felt like yes, like this program can be successful just in seeing how engaged people were in that initial training. And I can't believe it's been more than 10 years since that first training.
Oh my gosh, Kate. That was a trip down memory road and brought back a lot of really sweet memories. And the field has grown so much since those 10 years. There's so much more we know now about how violence against women and violence against children intersect. I think it was like in 2016 that Alessandra's Guedes' paper came out, really showing us the evidence on how there are so many commonalities between both these types of violence and what opportunity there is to do prevention work. And historically, it's been so siloed, right? Like those working with
Mhm.
children, whether it's on positive parenting, really don't often cross paths with those of us working on violence against women. And there's so much potential there, which brings us to the work at the collaborative. It's such a major strand of our work because it really aligns with our commitment to really bridge this kind of historic divide. Kate, can you tell us a little bit about the work you've been doing at the collaborative on VALVAC?
Sure. Thanks, Jane. And I think sort of building on some of the early evidence that the collaborative was synthesizing around like what types of programs are actually looking at both violence against women and violence against children. Parenting programs in particular came out as this really tangible opportunity to do more to address both types of violence. Like
Yeah.
parenting programs are operating in so many communities. They're working with parents and caregivers, but very often they're not necessarily addressing, intimate partner violence or thinking about the ways in which gender norms shape, relationships within the home, power dynamics, but also children's opportunities. And so together with partners, we've been trying to draw more attention to this particular type of program and the opportunity that it presents to address both types of violence. And we've been really lucky, I think, to have really strategic partnerships with a number of organizations like UNICEF, like Equimundo, to kind of come together and say collectively, we all have this really important goals, shared goals of promoting women's and children's health and well-being, and how can we work together to really draw more attention to the opportunity that parenting programs present to actually do more of this work. And one of the ways in which we've been doing that together, not only just in trying to draw attention to the evidence and the opportunity, but is actually responding to like the tangible needs of practitioners who are saying, hey, we're really interested in doing more on this topic, but how do we do that?
Yep,
And so one of the
exactly.
things that we've done both with UNICEF and Equimundo is sort of co-develop this series of parenting briefs, which is on parenting programs to reduce violence against children and women. And they really talk through not only the evidence, but like step by step, what can you do to adapt your program to really integrate, gender, to think about how you can address both violence against children and violence against women, and develop some tangible tools to support partners in doing that work. We've been able to do that in multiple languages and bring these briefs, into the hands of practitioners, which has been really, really great to see.
And how has the reception been to the work, doing this sort of advocacy and sort of narrative shifting and working with partners to really translate what the how really looks like? What's the reception been?
Yeah, it's been really interesting because I think there's been so much positive reception. We've been hearing a lot from partners in all different parts of the world about how valuable they found these resources to be, whether it was the brief that really supports you in thinking about step by step, how do you adapt your program? Or for others, we've received really positive feedback on the guide on like how do you actually measure change? What do you need to be thinking about when you're monitoring and evaluating your program? But we still see there's still some concerns or questions in the field about how to do this work in ways that, you can balance all the different things that parenting partners are trying to address in their programs. And I think we've been able to kind of work more directly with parenting partners to learn more about that. And I think that's something that you've been really deeply involved in. And so I'd love to, yeah, if you could share with us a little bit more about the work that the collaborative and you have been involved in supporting practitioners and why that's important.
Yeah, thanks, Kate. Our work with practitioners has really centered on creating these mutual learning experiences and supporting capacity strengthening through partnerships with parenting organizations or organizations who also do parenting programs. And one great example of this was through what we call our accompaniment program, where over 18 months we worked with an organization called Investing in Children and Societies, or ICS, in Kenya. The Collaboratives Prevention mentors worked with ICS to strengthen their understanding of gender, intimate partner violence, and prevention, and even help them to revise their curriculum to better address these issues. And what's great is that ICS went on to successfully advocate for the incorporation of gender, healthy relationships, into the national parenting curriculum that was adopted last year. And we, along with ICS, now serve on the National Technical Working Group that developed and piloted this new parenting curriculum. So it's through partnerships like these, and we've gone on to do several more accompaniment programs, but we've learned a lot more about what it actually takes to do this work. And it's informed a lot of the work since then with practitioners on on the steps that you need to take and where we can, and actually also now we have with ICS this sort of longer term partnership with them where we do a lot of advocacy together. So it's really been sort of a mutually beneficial partnership.
Yeah, I think it's been so great to see the work at ICS and how influential that's also been on the field. Like so many of the parenting partners that we've talked to, they're so much more convinced when they hear directly from ICS about how this work is feasible, how it's possible to actually strengthen your program in this way, and
Yes.
also to hear from them the concrete challenges they faced in doing it, right? So I think it's been really valuable to other parenting partners to hear from ICS's experience. And as you said, it's also informed our work of like, how can we do this work better in supporting partners to actually, adapt and strengthen parenting programs to address both VOW and VAC.
Yeah, that's absolutely right, Kate. Absolutely. And speaking of partnerships, can you share about how the work on fatherhood and parenting and violence prevention has been going in Rwanda? Because you're still very much involved in this work.
Yeah, thanks. And it's been such a journey of, this program in Rwanda, which, some of our audience might know, which is the Bandabureho program implemented by the Rwanda Men's Resource Center in partnership with Equimundo. And it's been amazing to see over the last 10 years that program develop from, a pilot of just testing, like how will this work in the community, to now something that's being scaled up together with the Ministry of Health, and has reached more than 50,000 parents in the country already, which is sort of blows my mind, I
That's
think, to think about
incredible.
when we think back to that first training. And it's been such a important part of, I think, both my personal and professional life over the last 10 years. And I think it's another example that is really great for the field to see that, it's possible to really, invest in a program and, then work together with government to take it to scale. And when I think about the parenting space, I think we're seeing more and more examples like that, where programs are working together with governments or with other partners to think about ways in which they can go to scale and reach more parents and caregivers, whether that's like in person or, through digital approaches or hybrid approaches. And so it really underscores the opportunity that does exist within the parenting space to really address both violence against women and violence against children. And if more programs are able to do that and sort of like disrupt those intergenerational cycles of violence, just think about how amazing that would be for preventing violence over the long term. And I think it's just a really important piece of work. And I'm so happy that the collaborative is so invested in this space.
Thanks, Kate, for those amazing reflections. I think it's a real testament to the importance of really strong long-term relationships, and so excited that we get to continue working together and learning about not only the work in Rwanda, but also the work that's happening that we're working on a more global level. So that brings us back to the beginning of our story of how we've been working together. Thanks everyone for listening. Please check out the Prevention Collaborative's website for resources on where you can find more on VALVAC prevention, including the briefs that Kate had mentioned and other really great material. Thanks everyone. Bye.
Thank you for listening to this episode in the Prevention Collaborative's Conversation series. Head over to the podcast show notes to find resources discussed in the episode. Also, there's a link to our website where you can find curated resources on our Knowledge Hub and free courses on violence prevention in our Learning Lab. And don't forget to stay connected with us on social media. See you next time.